the road to transplant is pretty stressful. Some of the things I just mentioned, you're trying to figure out what your diagnosis is, several tests, labs, trying to figure out what is the right cocktail for you as a patient. Depending on when you were diagnosed, it can be extremely overwhelming. I would say I was fortunate that I was diagnosed so young, and the internet did exist back in '94. It wasn't what it is today, but over time, I was able to find out as much information as I could. I was able to avoid dialysis. It was made very clear to me very early on that was my best chance for a better transplant success long term, and also that I should really try to get a transplant from a living donor. And it's like peaks and valleys, and this is what I feel visually that it feels like, because even after you get your transplant, it's not like you're good. You're not done. I was aware, as you start to read about transplant and the drugs that you're going to be on for the rest of your life, that they were strong drugs. I really didn't have a lot of options as to the types of drugs I could take. There's about 3 or 4 drugs that almost every patient is on post-transplant, different cocktail mix, and or any other medical conditions that they have and how those drugs interact. And post-transplant, a year post-transplant was the start of the pandemic. That was a pretty scary time to be immunocompromised while this disease is coming to life here. And then also, just getting care. No longer was it safe for me to jump on the train to go to a doctor's appointment, trying to make those extra adjustments, getting set up for home labs took way longer than, I hoped. And that's something that it's unfortunate, because I know a lot of patients, even to this day, they haven't been able to get home labs during the pandemic crisis. Post-transplant, then due to immunosuppression, you're constantly being checked for other things, like you mentioned some of them, but BK virus, any donor-specific antibodies appearing. You really can't relax, because you're not just testing your kidney function. It's all these other things that could happen. And for me, the most frustrating, I would say, is that I don't have a choice in this matter. I have the drugs that I'm supposed to take, and I have to take them every day at the same time, twice a day. And it's not like if you forget to take, a different type of medicine, like if I just had diabetes or something, like this is every time you miss a dose, the chance for rejection increases by a small percentage. And it's really sometimes really scary. And if you're not like a process-oriented person, if you don't have support at home, it might seem really easy to remember to take a medicine twice a day, but there are days where you don't feel well. There are days where maybe you weren't home and you forgot to put something in your car, or you're tired. It's a big burden. And there are times where I might even freak out if I realize that, wait, I look at the date, I keep everything pretty organized, and I'm like, did I refill my thing today and that's why it's empty, or did I not take my medicine? And then sitting in that moment, because a double dose is even worse, putting my body into extreme toxicity. So it's not like I could just take it just in case.